hopefully, yeah, you've all received that message, and if you could just click continue. Obviously, we don't have time for introductions for everyone, given the number of people who are present, but I'd really appreciate if you could rename yourself using the facility on Zoom, right-clicking on your photo and then putting your name and your organisation in the name box. If it's too long, please do just put your name in the chat and also your organisation, and just introduce yourself to everybody else. Kelly and I will be monitoring the chat throughout the workshop. Please do make use of this function. If you have any questions as we're talking about the JSA, please do put them in the chat, and when we get to a point within the agenda, we will flag those questions up to Simon and Mike, who hopefully will be able to answer your queries. So without further ado, I'll hand over to Simon to kick things off. So Simon is the Head of Intelligence and Policy at Leeds City Council, and he will be leading the workshop today. So over to you, Simon.
Well, thanks, Carl, and thanks everybody to make the time to join us this afternoon, and special thanks again to Carl and Kelly for organising it as well. You're going to have a bit of input from me, I'm afraid, today, but hopefully we'll break it up, and we've got plenty of time for kind of feedback and discussion, because it's really central to this process that we hear your views and take account of them and try to reflect them as best we can in the work going forward. So what we're going to do is we're going to go back to Carl in a moment, because he's going to talk about some of the current kind of methods and potential methods that we kind of look at the city and understand the city and learn about the city. But what I'm going to do following that is two things, really. Firstly, explain what the joint strategic assessment is in the Leeds context and what we hope to do with it this time around. And then we'll pause just to test that out and make sure people understand and are clear and are happy with that. And then the bulk of my session will be actually sharing with you the emerging initial messages from the analysis of the data that we've done, and I'll work through that. We'll then pause again for any clarifications or further questions, and then we've got a breakout into two little breakout sessions. One to think about what you've heard and if it chimes, and are there things missing, are there other sources that we need to look at. And then the second element is really about how we maximize the utilization of analysis and understanding of the city, and about language and accessibility and all that sort of thing. But we'll come to that later on. We'll do our best to keep to time. I think there's a little bit of flexibility built in there. And perhaps, Carl, if you can shout or give me warnings if I'm going on a bit too much, that'd be great. But first, actually, I'm going to hand you back to Carl, who's going to talk to you about, as I say, some of the current ways that we understand the city and some of the potential ways that we can improve our understanding.
Thanks, Simon. Kelly, are you able to bring my presentation up, please?
Yes, will do. One sec.
So I'm going to talk a little bit about some of the other ways which we learn about the experiences of people in Leeds. Some of the data sources that we have, and some of the ways that we report back the findings that we generate from the system to people and organisations within Leeds. So look at our methods of learning in Leeds. Next slide, please, Kelly. So this is a slide just about a little bit of context around the third sector. So this workshop is based around how we can, as a sector, use some of the findings within the JSA to develop our work, to work within the system, and also, most importantly, meet the needs of people and communities of Leeds. The third sector is huge in Leeds. This is a graphic from the forthcoming State of the Sector report, and it illustrates just the sheer size of the sector. 3,500 third sector organisations estimated in Leeds, of which 1,533 are registered charities. We also have a huge workforce within the sector, 9,650 workers, 40 to 70,000 volunteers. So hugely, it's huge in scale and massively diverse. And as a result, we generate a lot of information, we generate a lot of data. And we need to bear that in mind in terms of all these conversations. How can the third sector and the data generated within the third sector feed into the conversations that we're having around planning within the city? Next slide, please, Guy. So Leeds heralds itself as a data city, and it generates a lot of data across our different pieces of work, across the different systems, across the different sectors and organisations. We generate a lot of quantitative data. So the census, which was run earlier in the year, generates a huge amount of data for the city, and allows us to understand some of the experiences of people within Leeds. We also have data from our different systems. So a couple of examples: Department for Education, Department for Welfare and Pensions, the police all have systems which generate data and allow us to understand what happens within that part of the system. GP practices generate a whole load of information about their patients. Within my work in the local care partnerships, GP data is key to understanding how we can work with primary care and better adapt to the needs of communities. Leeds City Council public health data, labour market data, organisational monitoring data. Now, this is something that we collect routinely. So there is something about making the most of that information that we collect routinely within our organisations. How can that be integrated into the data that we collect across the city? How can we make better use of it? There's also a number of formal consultations which happen across the city. When I used to work at Volunteer Action Leeds with Rich, who's on the call, I worked within the Leeds Voices team, worked with the CCG to generate information from people who receive support from NHS services. How can we integrate that information into how we plan for future work within the city? Often put to the side is qualitative data. That provides us with a depth of understanding around how services are experienced by people. So the quantitative data is great at helping us understand trends, helping us identify patterns within work which is delivered. But the qualitative data provides us with that richness of understanding to really tap into what people experience from services, what people experience from living in Leeds. Qualitative data is generated through citizens panels. There's qualitative data from complaints and feedback mechanisms. Engagement and involvement work within the city often generates lots of qualitative data. And again, that organisational monitoring. We also generate information through conversations, through the relationships that we have with people. How do we feed that understanding that we have of people into our work around planning of the city? Next slide, please, Kelly. This slide indicates some of the ways in which we report all that data across Leeds. So Leeds Observatory is an excellent platform for accessing information on people in Leeds. and provides information on the key issues and priorities for people and communities, including work around health and well-being, housing, crime and community safety, and also information around deprivation within the city. The workshop today focused around the joint strategic assessment, so that aims to provide a shared understanding of key health and well-being needs and community inequalities within Leeds. Supporting the information collected and reported with the JSA, there are health needs assessment, providing localised and issue-specific information to support that broader context within the JSA. We also have public health profiles, which provide an overview of population and health and wellbeing issues within some of the systems and structures across Leeds. So LCPs, local care partnerships, primary care networks, all have public health profiles, as do wards. And some of that narrative around that data is provided within the Director of Public Health reporting, which is an annual report for the city. But there are also lots of other ways in which we report insight, report knowledge, report data around people. So there's lots of evaluations of our work which take place routinely. Often some of that information is just stored within our own systems or put on a shelf. How should we be making better use of that insight to support our system planning? Also, monitoring reports, websites, bulletins and articles. There's so much data embedded within our reporting, which we could make better use of. Next slide, please, Kelly. So people's voices are a key part of planning. As a system, we need to start with people and put people at the heart of all our decision making. When working with data, that principle can sometimes be lost. And to help prevent that within Leeds, we have the People's Voices Group, a network of involvement leads across health and care organisations within the city. It includes representatives of NHS Leeds Clinical Commissioning Group, the NHS Trusts, the local authority, and a strong representation from the third sector. Now, the PVG, the People's Voices Group, is facilitated by Health Watch Leeds and has been going for several years. We meet regularly and have subgroups around digital inclusion. We have subgroups around accessibility, but we have lots of relationships, can support with that coordination of involvement and engagement information which is collected across the city, and bringing that into the conversations around how we make best use of data within Leeds. Next slide, please, Kelly. So the People's Voices Group has a vision of putting people's voices at the centre of health and care decision making in Leeds, and in particular the voice of people living with the greatest health inequalities. And underpinning that vision, the PVG adheres to key principles. So putting the voice of health inequalities at the centre of all conversations. Involvement is linked directly into decision making. So making sure that involvement is meaningful and it's connected to how we plan and make decisions within the city. We seek to avoid repetition, avoid duplication of effort. So having those conversations as a system allows us to do that. There's a principle around involvement work being accessible to all communities. So not just speaking to those people who routinely connect and engage with services and talk about their experiences, but proactively reaching out to all communities. We also seek to close the loop on conversations. So when we are asking people for opinions, asking people to share their views, we actually feed back to those people to make sure that we are updating them on what we're doing with their information. Next slide, please, Kelly. So over the next year, the People's Voices Group has set an ambitious work plan. So we have put local voices into all the local care partnerships as a one-year pilot, bringing PVG representatives to be that voice of people and support with putting people at the centre of the conversations within the LCPs. Being one place to bring together all the insight. So we're planning the delivery of a repository for grey literature. So all those reports, all those evaluation reports, the monitoring that we hold onto in the system, using that in a way which allows other people across the system to use information to plan what they do. We're also developing a engagement repository to bring together all the range of engagement work that we do across the city and make it more accessible for people and organisations. Hearing the voice of inequalities. So some of you may be aware of the Communities of Interest Network that we facilitate at Forum Central. The PVG are a key part of that network, and we are using the relationships that we have developed within the Communities of Interest Network to bring the decision makers closer to people within Leeds. Bringing together the voices of inequalities with the most senior decision makers within Leeds. To link to that previous point, we've developed an allyship programme. So that is where we bring together representatives of the Health and Wellbeing Board with people within the third sector who are working with people and communities who experience the greatest inequalities. So recognising that the gap between decision makers and communities prevents sometimes that understanding of the experiences of people. And through the allyship programme, we're reducing that gap. Listening together after COVID. So recognising that we need to be more than ever listening to the experiences of people, listening to what people are saying about what's happening within Leeds. We're delivering a programme of events badged under Leeds Big Leeds Chat. So that's where we bring decision makers together with people in communities to talk about the things that matter to them. So that's going to be rolled out through the local care partnerships. We're going to have a digital Big Leeds Chat, and we're going to also have specific events which are focused around communities who experience the greatest health inequalities. We're also going to be working with organisations across Leeds to make sure that this information is embedded in the delivery of projects, of programmes of work. Next slide, please, Kelly. So I've included this slide just to finish things off, and provided a few reflections and provocations around the work that we do within the city. So the third sector generates a multitude of data and information which can help us as a system better understand the lived experiences of people and communities in Leeds. But is there a commitment from the established health and care system to integrate data and information held within the third sector into planning? And do we, as a sector, have the capacity, do we have the systems and resources to join things up? How are we able to feed the information that we hold into the systems that Leeds has? And what investment and support does the sector need to help integrate the data and information into system planning? Do we need to have additional support in order to make that integration happen? Next slide, please, Kelly. Okay, so that's the end of my introduction. Hopefully provide a bit of context for Simon's presentation. I'm not sure if time will allow us to take any questions at this point, but I'm happy to answer questions in the chat. And with that, I'll hand back over to Simon.
Thanks, Carl. Yeah, maybe we can pick up any questions kind of on that. But I'm going to pause at kind of a third of the way through what I'm going to talk about. So Just hopefully you can see that. If somebody can give me a nod or a shout, brilliant, thank you very much. So, two things. I'm going to cover what is a JSA in the Leeds context and what we hope to achieve this time round, and then spend most of the time looking at the emerging findings from the hard data rather than from the qualitative insights, though there's a bit of a mixture, I guess, really. So to kick it off, oh, there we are. So yeah, so that's what I'm going to do. But as I say, at the end, again, if you have these thoughts in your mind as we go through this, what we're keen to really learn is, how do the issues I'm going to be identifying as the emerging headlines and potential further lines of inquiry chime with you? And then in terms of, as Carl's begun to discuss, what can be done to make data and analysis and insights more usable for the third sector, but also practitioners, commissioners of service, decision makers, etc. So in terms of what and I'm sorry, the language joint strategic assessment, or the official term joint strategic needs assessment, is a terrible mouthful that even after all this time I have difficulty getting out. But what it is, there is a statutory obligation for the council to work with the CCG to produce a joint strategic assessment that looks particularly at the health and well-being issues across the city to inform the health and well-being strategy. And it's important that we clearly discharge that responsibility working in partnership as to our best ability. However, in Leeds, over the last couple of iterations of the JSA, we've adopted a much broader approach. So we use the opportunity provided by having a regular timetabled analysis of the city to do just that, to look at a much wider raft of issues and themes across the city. So our JSA looks not only at health and well-being, but it looks at the economy, and increasingly it looks at climate change and our aspirations towards zero carbon. So it's almost de facto a kind of state of the city, becomes a state of the city report. And this time round, we're keen to take that even further. So we want to move away from just the production of a summary report every 3 years that, some people like me may find incredibly interesting for a period of time, but then just sits at the bottom of a pile of papers on somebody's desk. But actually think about how we can establish a much more, real-time, interactive, probably web-based resource that is a place to come to understand the city, but also perhaps an interactive element that can promote debates and promote further insights and get us thinking more effectively about collaboration and solutions. So that's what we're going to be trying and doing over this next period. I think the other challenge is to get beyond what these things often do, which is describe the city. We need to think about how the analysis informs, our priorities and our strategic priorities going forward, but also the allocation of resources, and perhaps even more importantly, the evaluation of the effectiveness of our interventions. So that's kind of an important element of this as well. And then the final bit on this slide is that, as I say, the traditional title is a JSNA, Joint Strategic Needs Assessment. Now, as you'll see, we're not shying away in the analysis about the needs of the city, but we also believe you need to think about the assets and the opportunities and the innovation across the city and within our communities. So we're going to try and do a better job at also acknowledging, understanding and identifying the assets that we have in our communities and across the city. So I also think it's a kind of pivotal moment to be looking at the city. So clearly, well, I've said post-pandemic, but hopefully you know what I mean. In this phase of the pandemic, you know, there is a real opportunity and indeed a need to further review, to test, to rethink, possibly revisit priorities. You know, the COVID-19 shone a really harsh light on the deep-rooted inequalities across the city. I mean, I know there's a national picture, but there's a city picture as well. And I think, you know, there is a need to re-evaluate how we respond to those challenges going forward. The positives that have come out of our response to the pandemic is sharing data and analysis and collaborating didn't always come naturally to certain bits of the city and certain sectors in the city. I think the third sector has led the way on this, but I think the response has really opened doors that are going to be very difficult to shut again in terms of collaboration around data and analysis and research and kind of shared priorities. So I think we really need to capitalize on that. Clearly, the interdependency of the economy, the labour market, health and well-being, the lifestyles and living conditions of people, the environment, and the links between them have become even more important as from our experience over the last 18 months. I've said a little bit about collaboration, but we've also worked very closely with the universities and other large institutions across the city in response to the pandemic. And I think this is where what Carl was talking about, there's a real, it's more than an opportunity, it's a necessity, I think, to adopt a far more responsive approach to kind of the qualitative lived experience insights that we can gain by working across the city. I can kind of paint a picture based on analysis and data and kind of economics and labour market, but it doesn't necessarily reflect what it's like to live and work in the city in different communities across the city. And I think that's really important. The other thing just to mention, just to highlight, there is work underway which is started primarily with the council and the CCG, but working outwards, looking at how we can more effectively build infrastructure and collaborative platforms to look at data and share data across the city. And it's got the rather grand title of City Office for Data Analytics. It's very early days, but again, I think the input from the third sector into that work before it goes too much further is really important as well. And then I guess finally, we've got a relatively new council leadership. So there's always an opportunity to have a think about revising our priorities and look at our priorities. There's a new mayor in West Yorkshire, and there's a whole raft of new funding regimes that the government's throwing at the levelling up agenda. And we are, this is probably for another time, but we are looking at moving towards a kind of much more explicitly partnership-based approach to city planning over the summer and into the autumn and into the spring of next year. Joint strategic assessment being a strong evidence base is an important input into that work. Now, that is what we're trying to achieve, and hopefully why we're adopting the approach that we're adopting. I'm going to pause there just in case, because what I'm going to do next is now talk you through what the initial analysis is finding. But I'm just going to pause there just in case there are any, you can always pick this up at the end, but if there are any questions about the approach and why we're adopting the approach and some of the outputs that we're going to produce. While people are thinking about that, I'll just say a couple more things. I think there's a dual time scale for this. So there's the statutory bit that informs the health and wellbeing strategy, which we're working on over the summer with a statutory obligation to provide a summary report that feeds into the health and wellbeing review of the health and wellbeing strategy in the autumn. So that's one thing. The longer term, the medium term thing, so 6-12 months, is working with partners to establish this much more interactive, shared collaborative platform providing insights into the city. So I should have just being clear about that. So is there anything anybody wants to ask? Because I'm conscious that I'm 7 minutes behind the timetable. So if we can make time up, that's always a good thing. I'm seeing no hands. And Kelly or Carl, can you see anything on the chat? Nope, good. All right, so now breaking it up. So I always start off looking at the population of a place when I'm trying to understand it. And I think there's a few things to pick up. A number of them you'll be very familiar with. So like the rest of the UK, and indeed like the rest of Northern Europe, and indeed the rest of the developed world, we've got an aging population, and that trend is set to continue. What we've seen, however, over recent years is a spike in the number of young people, birth rate in the city, and also an increase in the number of young people in the population, driven in part by economic immigration. And that's resulted in the profile of the child population becoming far more diverse, but actually, as we'll see in a moment with some of the data, far more likely to be living in communities that are likely to experience poverty. Now, that said, this birth rate bulge that terrible phrase, but we had over the 2010s is beginning to fall back. So it's beginning to see a decline in the birth rate, though the bulge of the 2010s is now kind of going through the school years. And in the next 2 to 3 to 4 years, they will beginning to go into the bulge will be go into the post-16 age group. And if you think about what's happened to the labour market, education, and job prospects as a result of COVID, clearly there are some issues that we'll need to consider there. There's also some variations in the growth of population across the city. There's also some early indications that we're seeing the impact of Brexit on patterns of immigration, but a lot of that's been masked by the pandemic, where actually the whole movement across countries has kind of been frozen. And, you know, those of us who are near to this stuff will be pleased when we get the 2021 census results, because, you know, we're still looking in large part at data which is over 10 years old. And just to give you a flavour how much it's changed, according to the 2011 census, about 19% of the population were from Black and minority ethnicities. If you look at school children now, it's about 35%. So we've seen, but that's not picked up in the census data, obviously. So we've seen some real changes in the richness and the diversity of the nature of the city. So just some pictures, really. So this one these are population trees, I call them. The one on the left is Leeds, the one on the right is England, and it's age. So it's females on the left, males on the right, and it's age 0 to 90 plus. And what you see about Leeds is a huge bulge in young people. And the primary explanation for that is the students in the city. We've got 70,000 students in the city, and that's reflected there. But what that bulge masks is this stronger foundation of the tree, I guess I'd call it. So we've got a higher proportion of young people in the city against the national average, which again is and can be and should be a real asset to the city. But we need to ensure that those children get the life chances and the educational opportunities that they need to fulfill their potential. This picture, and I'm going to run through a lot of these quickly, but just to give you a flavour, this picture shows the heat map of population growth in the city. And the dark purple are all those areas which have seen the most population growth, and the green areas are actually areas that have seen either stagnation or actually loss of population. And what you see is it's the inner city areas that are seeing the strongest population growth. And this map, many of you are familiar with, is the index of multiple deprivation, which is a kind of an index of factors that identify relative poverty and deprivation across the city. And the darker colours are those communities that are more likely to experience poverty and a range of disadvantage. And you see that there's a correlation between growth and those areas. I think the index of multiple deprivation splits the city into 9 deciles. Decile 1 being the most relatively, and forgive me for the language, but it's the language they use, the most relatively disadvantaged, and the number 10 being the relatively least disadvantaged. And what this does is just do the population counts when you split the city up along the deciles of index of multiple deprivation. And you see that our most deprived communities are our most heavily populated, significantly so, which is no great surprise if you think about housing density and the nature of the housing stock. But Leeds is a bit unusual because most cities, when you look at this map, you'd have a bit of a hockey stick where deciles 2 and 3 would be taller. Leeds isn't, and I think the reason, those of you who've heard me talk about this before, the unique nature of our housing stock, with the kind of the remaining housing stock from the turn of the century and into the 19th century, and with that fact that we've still got 20,000 back-to-back houses, really does that. The other important thing to say is that old people or older people, again, I need to be really careful about my terminology, but older people account for the single largest group in the most deprived communities. So again, there are some views about where the aging population reside, but increasingly they are concentrated in our most deprived communities, which I think is something important to consider going forward. At the other end of the age spectrum, this is the skilled population by the index of multiple deprivation. And again, it's even more stark when you see the number of young people living in our most deprived communities. And there's been significant growth in the young population in those communities. So again, a rapid fire tour, but some of the challenges, issues we're finding from the empiric data. Looking at health and well-being, clearly this is an important consideration of the JSA. And there's a lot of data in it. I'm not going to touch upon most of it, but just pick out some key things. Prior to COVID, as we all know, tackling health inequalities was absolutely central to our approach, with a focus on the terminology used in the health and wellbeing strategy, the poorest first. COVID shone a significant light on that, and we've seen a direct correlation between the impact of COVID and poverty. And there's two elements to that. One is around health conditions. So people living in these communities are more likely to be encountering health conditions around smoking, obesity, the limited ability for them to choose healthy lifestyles, poverty being the key factor there, but also exposure to COVID, which is around ability to work from home, high density multi-generational households, a much stronger reliance on public transport, again, poverty being a kind of key factor there. So, and I've talked about the kind of unique housing tenure in the city. But again, the JSA will look at a lot of health data, but I'll just pull out a few factors. So this map, the map on the left is the index of multiple deprivation. So it's kind of the darker the area, the more deprived by local authorities in England. And then the map on the right was the second wave of COVID and its impact. And it doesn't take Einstein to see a correlation between those communities encountering deprivation and the impact of COVID. If you looked at Leeds, I've shown you this before, I would bet my bottom dollar that if we do a long-term analysis of the impact of COVID on the city, it will look somewhat like that map. And then we choose, whatever indicator you choose, whether it's mortality or whether it's long-standing diseases, what we do in the JSA is map the Leeds average and then break out the deprived Leeds. So this is again the most deprived 10%, and look to see what they're happening. So what we want is all the data going in a positive direction, but the gap closing. And I think what we are seeing as a longer term trend, probably exacerbated by COVID, is that there's a stalling of progress and the gap isn't closing as quickly as it should do. So I think that's a common theme. And again, picking out, if I had to pick one table to look at health and well-being, it'd probably be this one. And this is life expectancy by ward at birth. And you've got a difference in life expectancy between Birmingham, Tofts and Richmond Hill. Male life expectancy 72, female life expectancy 74.3. And Adel and Wharfdale, where male life expectancy is 83 and female life expectancy is 88. So 12, 13 years difference for 4 miles across the city. So these are the long-standing challenges that, this is nothing new, but clearly in the context of COVID, we need to think about how we renew our efforts in terms of addressing these gaps. So young people, I'll say something briefly. There's been a lot of narrative over the pandemic about the impact on our young people and children. Never mind the gap in education, but the kind of impact in lockdown in terms of disengagement, particularly of our most vulnerable, and at the extreme end, worries about radicalization, antisocial behavior, and the impact of gangs and youth crime. There are concerns about, and again, this is a national issue, about that catching up of this generation in terms of the educational, the gap in their educational provision. And we had some long-standing issues in the city for the children who if you look at the measurement, those in receipt of free school meals, and the gap between that cohort and the rest was already quite large at preschool and primary, though we actually managed to close it in secondary school to a certain extent, but COVID's likely to have exacerbated that. There are issues around growth in the special educational needs cohort, and there are well documented concerns regarding the mental health of young people. In terms of child poverty, the government's actually started providing data again, and they provide some data that looks at child poverty for its under 16-year-olds before housing costs. And it's estimated, according to the government's data, that 19% of children in the city under 16 are in relative poverty, which is quite a stark figure. The figure for it's 24% for the city. Sorry, 24% of the city. It's 19% for the England. But I mean, 24% is almost a quarter, which is quite astounding, really. But in some of our neighbouring authorities, it's even more acute. So if you look at Bradford, the figure for children in relative poverty under 16 is 38%. And if you take the leafy district bit out of Bradford, then you're looking at probably 50% of children in child poverty in downtown Bradford and Keighley. So there's some really stark issues there. And I'm racing through this, but I might go over a little bit over time if that's okay, Carl, but I just want to kind of cover this. So looking at the economy and the labour market, and again, there's been a lot of discussion and narrative and analysis in the national press and think tanks about what's going to happen, what's happening and what's going to happen. Pre-COVID, Leeds had some significant strengths. So we've experienced across the city a fairly long-term period of growth and expansion. We've been blessed with some strong sectors, from the business and financial services into digital, into advanced manufacturing, and in the cultural sector. And we've got a high proportion of knowledge-based jobs that demand high levels of skills and pay well. And we've also, quite strikingly for a northern city, got high levels of employment. That said, there were some signs of stalling and slowing of that growth just leading up to the pandemic. And a thing that I'm sure many of you are aware of, too many of the jobs created in the last 10 years have been relatively low skilled and low paid in service sector. And so although we've got really strong, I'll illustrate this in a minute, but although we've got really strong employment, our productivity isn't as good because we don't pay as well and we haven't got the skills in many of our sectors. So there's something there. So COVID obviously impact of the lockdown, the growth of home working, concerns about, Armageddon for city centres, and, a new geography of employment with the growth of the suburb and the satellite and all of that. Big impact on hospitality, on culture and consumer services, obviously. Also impacted uneven across communities. So young people, women in the labour market, the lowest paid, were most likely to be on furlough and least likely to be able to work from home. So a really uneven impact. What's going to happen now? Well, going forward in the long term, there is this issue around lower pay, lower skilled employment base and how we move that forward and upward. I think there are some issues about home working and what that might mean for city centre versus suburbs and satellites. I don't think it will be the death knell of Leeds city centre by any means. And indeed, I think even though some places like our neighbours did relatively well compared to the city centre through the pandemic, so I'm talking about places like Huddersfield, Wakefield and Halifax, that's soon fallen back and been reversed since the easing of restrictions. So we're almost back to higher normal levels of footfall across the city now. Although there will be a question about new ways of working, what that might mean. Again, just to illustrate some of this. So this graph is easy to understand than you might imagine at first glance. So the bottom axis is the employment rate. So it's the proportion of people working. And so the further you go to the right, the more people are in work in your city. And the left-hand axis is the value of the economy. So the higher up there, the more value your economy is producing. So where you want to be is the top right-hand corner. And all these dots are the large cities in England. And the ones coloured with names on are the core cities. So they're the largest cities outside London. And the only core city that gets into the kind of top of the class box is Bristol. And I'd argue that Bristol isn't really a post-industrial city at all. So it's a bit unusual in a way. And so the next two cities are Leeds and Manchester. So we're on the fringes of being where we really want to be. And we're there primarily because of our employment rate. And Manchester's there primarily because of the value of the goods and services they produce. So to get into the top class, Manchester needs to boost its employment rate. And for us to get into top class, we need to boost the value of our economy, which is linked to the value of the wages and the skills in the labour market. So the two are very much linked. So I think that's a neat way of almost highlighting both the strengths, but also the weaknesses in the economy. This table is nicked from the Centre for Cities, which is looking at incidents of home working and furlough. And again, it might give you an inkling of what might happen in the future. The bottom axis is the estimated ability to work from home during the pandemic, and the left-hand axis is the take-up of the furlough scheme. And Leeds hasn't had a huge take-up in the furlough scheme compared to some places, because we've had the ability for many of our workers to work from home, reflecting the office nature of the city centre and often the knowledge skills that people do, and white-collar workers are able to work from home, which is all well and good, and I think is I'm not saying it's a bad place to be at all, but if home working becomes the norm, or much more the norm, the knock-on impact in the loss of footfall in the city in a place like Leeds might be a factor. So it's worth kind of looking at. Well, I'm nearly done, so a couple more just to wrap it up, and I know this is a really quick run through. We're also keen, as we, to understand the pace of the return to whatever a new normal will be. And I guess there are a number of indicators that we're all, well, not we're all, but people like me are looking at, I guess. So public transport. So although we've seen a much bigger easing of lockdown, we've seen places open, bus use is still only running at 50% capacity from the baseline before COVID, and train use at 40%. And I think there's a difference between buses and trains, because in many ways buses is less of a choice to travel on than a train is. And I think there is many people who use a bus have no choice, no other means of transport than the bus. Whereas the train, with the wider geography of train use, there are choices that people could always use the car. And I think therefore we need to think about both those modes of transport. Car use there was a dip in the early days, there was a huge dip in the early days of the pandemic, but it's almost back to pre-COVID levels now. So there is an issue about that. Active travel, we saw a huge expansion of active travel in the early stages, and I think a lot of that has been retained, and the trick will be to retain it further. But again, there are personal choices, but also interventions to make it easier for people to choose active travel options. I've become quite obsessed about footfall in Leeds City Station for some reason over the last 6 months, but we've seen peaks and troughs, and as I said earlier, footfall across the city is returning to pre-COVID levels, but the extent to which that means economic activities returning to pre-COVID levels in the city, we're still not quite sure. And there's been some recent work by the Chambers of Commerce and the Combined Authority with surveying businesses about their intentions to return to the office. And 50% of all businesses surveyed envisage some sort of mixed home working return to the office approach. So many saying, 2 to 3 days a week will be the normal for us in the office. So again, that could have quite profound impact on those businesses that are reliant on office workers to buy a sandwich or buy a coffee or do that bit of quick shopping or even get their car serviced. So there are potentially some wider range issues here. And again, the future, the geography, the rebirth of the suburb and local services versus the city, again, are all quite live issues. And then finally, and I feel a bit of a fraud only touching upon it towards the end, but basically this is where there is less empirical data, but it is an absolutely vital element of the analysis of the city. But what we want to do is also have a much deeper look at the challenges of climate change for the city, and we're working with the universities in the city, particularly University of Leeds, to think about how we can model and get deeper insights about the impact of climate change, not just on the normal things about generic air quality, but actually on individual communities across the city, because there are things, flooding is the obvious one, but heat and the cost of heating, but also the heat of the environment and what that might mean in the future, in the 10, 15 years from now, are all really important. So this is an area that we want to expand, and an area that I want to come back to again and again, I think, really. But again, some of the things that we need to think about are, we had a taste of what a green economy could begin to look like, or parts of a green economy could begin to look like in the early days of the pandemic. And is there lessons that we can learn from that? We need to think about how we kind of influence habits and increase choice. But obviously, a lot of this is not just national; it's pan-national in terms of how you address a lot of this. But it's something, as I say, we'll come back to. So that's a very quick run through. I'll pause now. So I think all we said we'd take generic questions on all that diatribe that I've just gone through, and then we'll move into the breakout groups, if that's okay. So I'll stop sharing my screen.
Thanks, Simon. Does anybody have any questions just before we go off into the breakout groups? David Smith.
Thank you, Carl. Yes, yesterday I attended a Forum Central meeting where they'd invited some people from the new Population Health Management Planning Directorate in Leeds CCG. We haven't heard anything about PHM today. Will you be working with those PHM people? Because they'll be doing something very similar, I imagine.
Well, we're working very closely with the Public Health Intelligence team, who are the kind of conduit who support that work. So the health and well-being analysis is being led by that team. So yeah, there's an absolute crossover in terms of the work that we're doing, and we are hoping that they won't be doing something similar, that we'll be doing just one thing once, if you see what I mean, David.
Yeah, great question, David. And conscious my work in the local care partnerships, PHM is a key part of the equation, and I think we're always trying to make sure that we are avoiding duplication and working together as a system.
And we've got colleagues from the CCG involved in we've kind of got, we've got a whole range of sounding boards, but we've kind of got a sounding board that came out of the Health and Wellbeing Board, and the CCG are pretty well represented there, as our wider health partners and third sector partners.
Great.
Rose?
Rose, yeah.
Hi, I wondered, are you going to take into account the government's plans for immigration and the impact that's going to have on people seeking asylum in the city and those who actually come but then don't legally seek asylum and go under? Because I fear we're going to have a lot more of that, because whatever the rulings are, people will still find a way to get here, but they may not seek asylum because they could then actually get into trouble, even prison, whatever. So are you going to take that into account in your plans? Because it could come through quickly, which is pretty awful in my view.
Well, I think, Rose, that's where we're keen to kind of engage with colleagues who are close to some of these issues, because the empirical data just won't capture this at all. You know, it just doesn't. So I think those local insights and intelligence, we are keen to hear and take account of. So yes, but in terms of, you know, what the data's telling us about in-migration is, you know, based on kind of proxy measures like the school census data, which is a good indicator of families coming into the city, and people applying for national insurance numbers, which again is more of a formal in-migration rather than under the radar. We are seeing a slight drop-off, which, as I say, whether that's Brexit or whether that's COVID, it's too early to say. But I think we are seeing a drop off of those formal routes of in-migration. So those informal, below the radar routes, we need to clearly better understand.
Just to say that, you know, formally people can claim asylum and they won't get a national insurance number whilst they're doing that, and that's the situation at the moment. But the immigration plans could really affect that, and you know, they're trying to push it through quickly. So I think it's something you really need to take into account. There's lots of information about it on a national level. I'm from the Refugee Council, and on our website there's a lot of information about the impacts of the plans will be. There's also a campaign called Refugees Together, which has many organisations part of it, which is trying to gather the latest sort of information, which would be a very good website for you to get information you might need to help with your planning.
Great, thank you.
Thanks, Rose. Really conscious that we're running a little bit behind schedule. Also really keen to fit in a break because there's a lot of information to take in. So is it okay if we push the agenda back a little bit and have a break until 25 to? And that gives Kelly a chance to put everybody in the breakout rooms for a discussion. Thanks, Kelly. Simon, I can't see you on my screen, but I'm sure you're here.
Yeah, I'm here.
Excellent. How are we doing for time? And I'm conscious that we had a conversation about bringing Councillor Dowson in for an item on the agenda. It'd be really good to have a little bit of feedback from the group. I don't want to take over your time, Councillor Dowson.
No, don't worry about taking my time whatsoever. Sorry, I'm very much half a face person. I do apologise. Please don't worry about me at all, because I'm just interested to have as much feedback as we can get from the people who are here. It's not about me, it's about listening to you. I've been in a breakout group and it's given me some really interesting information and a take on the way that the council deals with information and what it's asking for. Is it relevant? If it's given, are we going to take take any notice of it. Well, I can tell you we are going to take notice of it. It's capturing the statistics that you get, because you can hold those in your hands, you can see them on a bit of paper, but what we also need is the things we can't get down on paper. There aren't statistics, but they are your experience from the work that you do. I think they call it the lived experience now. You know, we need to work out how we can capture that. As Rose was saying, the people who aren't counted, whose voices are not heard, how do we capture that? Because when we're looking at a city plan, when we're looking at a JSA, those are the groups we desperately need to actually hear from, either through you or directly from them. And you're our gateway into those people, to actually hearing their stories, what their experiences. And then I always ask the question, so what? You know, there's no point creating a whole book and raft of statistics if we're not going to do something about it at the end of the day. So the big question when we actually have all this data and this information is actually, so what? What we're going to do with it to make the lives of the people of Leeds better. So I'm new to this job. I heard somebody say earlier, I'm new to this. I'm new to this as well. And I'm learning all the time. It is interesting. I hate that word interesting, because it's so detached. I don't want this to be a detached piece of work. I want it to be something that everybody in Leeds can actually get behind, because at the end of the day, it will make a difference. That's what I'm hoping. So I'm going to shut up now and I'm going to listen to what you've got to say. Thank you.
Thanks, Councillor Dancer. That was incredibly powerful and absolutely in tune with what we want to do within the third sector. Make sure that any work is action focused. Just going round the groups, if we could have just 1 or 2 points from each of the facilitators in the breakout groups. Councillor Dyson, I'm not sure what group you were in, but whoever was the facilitator, if they could just kind of come forward and add anything to what was said.
Yeah, I was in the group. I think Councillor Dawson summarised it perfectly, brilliantly. So that's what we were looking at, capturing the right data, and how do we make sure that the data that's not captured, how do we get it? For example, what Councillor Dawson said in terms of lived experience, and then what happens afterwards? How do we deal with the information, and how do we make sure that everyone's voice is heard? And this is where we get in touch with the community, the smaller groups. There were also suggestions about using values-based principles, valuing the work and factoring that in, looking at what rules and what good data looks like, and perhaps then mirroring from that perspective. And pretty much in terms of, there was an emphasis of understanding communities. We narrow the gap by understanding the communities, understanding prevention. So that's what the way we do that, we capture that, is by, well, having that engagement with us and other smaller groups and communities.
Thanks, Gabby, that's great. Could I move over to Sarah, please?
Yeah, absolutely. So question 1, we just talked about smaller, more specific data units in general. So topics that came up were ethnicity and education, ethnicity and prevalence of health conditions, so that third sector organisations could apply for specific funding to work with the most prevalent conditions in the communities they work with, more specific data on disability and women and health. And then in the second question, we talked about more reporting back into communities, making it accessible and doing that legwork to unpack the data and making it meaningful for people. And we also had wider conversations on monitoring reports that the third sector has to complete and how that data can feed into wider data collection and inform the work. Debani, I know that was a really important point. Did I describe that okay? Or is there anything you'd like to add? Okay, good.
That's great.
I see a nod. Great, that's all for us.
Perfect. Damien.
Sure, yeah. We focus mainly on the first question. So we were talking about how there's a need to gather information about the people under the radar who perhaps aren't on the books, so to speak, from like refugees and asylum seekers and some gypsies, homeless, I suppose. There's also a point made about how the previous summaries with the JSA in 2012 and 2015 said that for those particular communities, we don't know a lot about it. And you know, that now is the time to actually go out and get that information, and the third sector holds a lot of that sort of intelligence about those community groups, that they've got it there ready to give. So a request to go and get it from them, from us, if you like. More about the wider determinants of health felt was needed in the JSA, and there are organisations out there who can do awareness raising, sort of training about the communities they work with as well, and a request for a more gendered approach as well for health inequalities, particular to men, and health inequalities particular to women, so that you can take that gendered focus there. In terms of what do we, how to present that information, we didn't get too far with that because there's about how to share it. And we spoke a little bit about making it relevant to your particular community that each organisation is supporting. But there was a little big up for the Leeds Observatory and how well they do in sort of getting this information out as well. And that was us. Thank you.
Thanks, Damien. And Rich.
Hi, we had a fantastic conversation in our group, just brilliant. So just a very practical one around lines of inquiry. Need to drill down into population, and particularly around older populations. The one person was very interested in the experience of 50 to 70-year-olds. It was talking about employment and how unplanned unemployment might be the end of someone's career at that age. So some work, maybe some drilling down to do there, and then a really brilliant conversation which absolutely linked across to what Councillor Dowston was saying about needing to understand people and place and how people live and what people want, and having that narrative and that really a real understanding of what makes the people and places of Leeds tick, and that's what we talked about, and it was fantastic.
Brilliant. Thanks, Rich. And just a couple of points from my group. We also talked about the need to have more nuanced analysis with a focus on diversity and those who experience the greatest health inequalities. We also talked about the need to feeding assets. So what is going on within each part of Leeds, within communities of Leeds, and how can we overlay that information into the analysis of need? And we also talked about opportunities to communicate the information in a much more creative way, using infographics and focusing on the relationships that we have with communities, investing in those relationships to make sure that the information, the data is applied in a solution focused way. We've just hit 4 o'clock. I'd really like to thank Simon for a brilliant presentation. I'd also like to thank Kelly for supporting the work in the background and making sure everything runs smoothly. I'd also like to thank everybody for being here today and being so willing to contribute to the conversations. In terms of next steps, I'm going to be bringing all the information together and producing a really brief report, and I will be sharing that with everybody after this session. It's just gone 1 minute over, really sorry. Thank you so much. Please do continue the conversations, and if you have any questions, please come back to me or colleagues at Forum Central.